Hi there. Are you frustrated with the care that your patients and families are getting today in the system? Are you passionate about patient advocacy and wish you could do more of it? Me too. My name is Karen Mercereau, and I have been a clinical RN for 49 years. Time flies. Anyway, 15 years ago, I had a really big idea. I started looking around at where all of the actual problems are in the system, and I'm sure that most of you have done the same thing. So it occurred to me that nurses could create a safety net for their patients and families to educate, to advocate on their behalf, to guide them to their best health outcomes, and to teach them how to do that when you're not there. I've been around a long time, and I have never seen the system in such disarray as it is today. Consider this. In September of 15, the Institute of Medicine published a study demonstrating that there are 12 million misdiagnoses every year in the US. Imagine that. And now here's another one for you. Health literacy is topping out at 12% in the US. People have no idea where to get accurate information. They get most of their information from commercials. I think we can do better than that, actually. So let's take a look at what professional nursing has done historically to address major national health issues. Flip the page back to the turn of the 20th century, when we had masses of immigrants coming in, landing in tenements, mostly in big cities along the East Coast. These tenements were teeming with epidemics of cholera, diphtheria, typhoid. Infant mortality was extremely high, nutrition was terrible. And so what did professional nursing do? We created public health nursing and turned that tide. Move ahead a little bit. In the early 70s, there were not enough primary docs. There still aren't. And so what did professional nursing do? We created the role of the nurse practitioner. That was a really good move. And still very active and vibrant and providing good care all over this country. Then, 10 years later, when early 80s, managed care came in with all of its flaws, and nobody knew how to work with it. So what did nursing do? We created the role of the RN case manager. So what are we going to do today? Patients are having bad outcomes. They're dying from preventable medical errors. They have no idea what's going on in their bodies. They do not know where to access good care. Nobody's teaching them. So what is nursing doing? We have created the role of the independent RN patient advocate. And our partner in the educational arm of this is the University of Arizona College of Nursing. What would you think if you could actually do what you knew was right for your patients and their families? It's a wonderful feeling. If this sounds intriguing to you, you might just want to check this out further. Thank you.